All right, in this video today, we're going to talk about radiation safety when it comes to us as personnel in the dental practice. As we know, the dental assistant takes many different radiographs throughout the day, along with our hygienist and our dentist. So if you're using a handheld unit or if you're using a wall unit, we need to make sure that we're keeping ourselves safe and not exposing ourselves to unnecessary radiation. As we know, dental radiographs are very minimal with the amount of radiation that the patient is receiving during their dental appointment. But what we need to keep in mind is that us as personnel, we're taking many x-rays on many patients throughout the day. So making sure that we're properly using our handheld unit. Some factors would be if we're using our hyperlight, that our torso is to be behind our barrier here, that when we're exposing our patient to our radiation. As you can see, we have our individual saw here with a BiteWing XCP in the mouth, that I am standing on the right side of the patient. Sometimes the left side of the room is tight. As we know, we work in some operatories that are very small, that what we do not want to do is reach around as such. And now when I hit my button for radiation, that any of those x-rays are then penetrating into me as a patient or as a dental assistant. So we do not want to do that. We want to make sure that we are turning to the other side of the patient side. We have our other devices as well that are handheld, that of course a sensor would be placed in here. And we have our snap array device as well, that we know that this is used very commonly in pediatric offices. So who is holding these devices in the patient's mouth? Who is holding this when you're getting your check film during your root canal procedure? A lot of the times, us as dental assistants, that we are the ones that are holding this in the patient's mouth and then maneuvering our hyperlight or our handheld unit and hitting that button. So we are definitely exposing ourselves yet again to that unnecessary radiation. So what do? Who's holding this? Have your patient hold this. Put this in your patient's mouth, put your snap array in the patient's mouth, and have them hold it. Or if you have a family member, if a parent is in the room with your pediatric patients, of course we don't necessarily want that parent to be exposed to that radiation, that they are not getting the x-ray. But yet again, keeping ourselves safe as dental personnel is what we're talking about here. It takes many x-rays that we would have to get to that point of overexposing ourselves when it comes to radiation, but you must take a stance of keeping yourself safe as well. If you are not sure or you're not comfortable with using a handheld unit like the hyperlight, or if you've never had any proper training, you do want to contact a representative for that company and get the training that you need. Speak up to your office manager or your dentist that I'm not really sure if I'm comfortable in this situation. If you're a female and you're pregnant, making sure that you're taking those avenues to keeping yourself safe and eliminating that overexposure, or not even overexposure, but just unnecessary radiation. Follow that same Alera rule that Danby has into play for our patients, as low as reasonably achievable, making sure that you're also keeping that exposure to yourself as low as reasonably achievable as well. So hopefully this helped. Radiation safety is extremely important to our personnel and our health. So get that training that you need to get yourself even more comfortable.